Welcome back to Africa 54. A new malaria vaccine is making headlines, and our health correspondent Linord Moudou is here with the details. Welcome, Linord.
Hello, Vincent. Hello, everyone. Well, researchers say the experimental malaria vaccine offers nearly 100% protection against infection in healthy adults. But there are limits. The vaccine is made by irradiating mosquitoes that have fed on malaria-infected blood and removing their salivary glands on hand. The radiation weakened parasites in the saliva and then purified. In earlier trials, the vaccine failed when injected into the skin. So this time, researchers from the Army, Navy, and National Institutes of Health gave it by IV drip. 6 volunteers who got 5 intravenous doses did not get malaria when bitten by infected mosquitoes. Because the vaccine is made in small batches, it's currently impractical for poor countries, some observers say, but could work for the military and wealthy travelers. Joining us via phone from the National Institutes of Health is Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome to Africa 54.
Thank you. Thank you. Good to be here.
Are you surprised by these results?
Well, we're not surprised in the sense of that we were hoping that we would find these results. They were really quite striking from the standpoint of a proof of concept. But as you correctly mentioned, there are still obstacles that need to be overcome. The good news is that these are the best results we've had thus far with malaria vaccines, but the challenge is that there are still logistic constraints about delivering this in the intravenous route in a way that would be applicable for mass vaccinations, which still needs to be proven in the field where it really counts.
And now we saw that actually the trial was conducted on 50 adults.
Right.
Now, we know that most of the victims are children under the age of 5, for the most part in sub-Saharan Africa. Are there any prospects in terms of testing these in children?
Yes, indeed. In fact, the next phase of trials, which will be taking place not only here in the United States, but also in developing countries such as Tanzania and Mali, will be to determine if in the field it does work both in adults and in children. So these are all things that need to be done before anyone can feel comfortable that this is a practical way to approach malaria vaccine. So encouraging results in the setting of the clinical trial, but we need to prove its full applicability in the real world.
Now, scientists, researchers have been working on developing a malaria vaccine for many, many years. What makes the science behind this vaccine or the approach unique to the extent that it could become an answer?
Well, the uniqueness of it is that you're using the whole parasite to induce a response. And as is the case with many diseases, if you get the entire microbe, you induce a very potent response. And that's indeed what we were seeing, which accounted for the high degree of efficacy. Even though the total numbers in the trial was small, the percentage of efficacy was very high, likely due to the fact that the vaccine that was used was actually the whole weakened parasite as opposed to a specific small protein or other component of the parasite.
So in the general sense, what has been the main challenge in terms of developing a malaria vaccine?
Well, the main challenge has been to develop a vaccine which induces a potent enough response to protect over a long period of time. We call that a durability of response. And that is still one of the remaining challenges with this vaccine. Even though it protected in a high degree, we still want to make sure it does that over a long period of time. That's a major challenge.
And in how long will we know that? Very quickly?
Well, it's probably, as in all vaccines, takes time. It will take likely years before we know that we have, if we are successful, a big if, but if we are successful, we'll have to know that over a period of a few years. It's not something that's going to be an answer that you'll get in a few weeks or a month.
Okay, Dr. Fauci, thank you so much for joining us.
You're quite welcome. Nice to be here.